FEI, NAMIF, and Equimaster bring you the Grooms course 2022 in Windhoek, Namibia. Dr. Yolandi van der Westhuizen, who is a registered veterinarian, takes the grooms through horses' health, vet checks, putting bandages on horses, and checking temperature. Much more is to follow. Let's take a look.
Okay, good afternoon. Thank you so much for your smiley faces and your enthusiasm. So we are looking at healthy horses and happy grooms. No, it's, I think it's very traumatic for everyone, for the owners, for the grooms, if the horses are sick. So that should be our main priority. And then I'm going to chat a little bit about groom as a first responder. So this just means that you see the horse every day for at least 12 hours, so you will notice if something is wrong. You know, you will be the first person to pick that up. And then I'm going to do something just like, you know, a bandage change, because I think that is quite common that you guys need to do bandages. So we look at that, that you need to take note of that there is plant materials and things that can contaminate your grass and your food that can be picked up when they do a drug test, you know. So it's just something for you to be aware of. And then we will also discuss a horse inspection, and we will do that one practical as well. So I have a little video for us from a groom. You know, she's taking us through her routine that she does every single day. So, okay, so underneath the jaw, we'll have to look at a horse, and I will make everyone feel that. You can actually feel it running there very nicely. So it's a nice place for you guys to count the pulse. Okay. So when we are at a horse, I will show you as well where you can feel if the feet are pulsing. Okay, I think Pete knows that one. Okay, see, so that's what she does every day. She takes the temperature, look at the respiration, look at the hooves, groom the horse. So it's always good to stand close to the horse. You can't get kicked too sore when you stand very close to it. Okay, but if you stand here, you're right in the sweet spot, especially when you have a new horse, you don't know him, okay? It's always good to make sure he knows you're here, okay? Yeah. So make sure that it's nicely in. Okay, when it's not nicely in, you will get a low reading, but it's not a true reading. Okay, it needs to be nicely in. So while you have also lifted the tail, you've looked that you don't see signs of diarrhea. All right. When you've put it in, you've looked under the tail, you didn't see any growths or something there. Okay, so it's fine. So now you have your reading. Okay. 37.4. Yeah. Okay. Then also, when we look at, you know, what we are feeding our horses. So I don't know if you guys, especially maybe older horses, we name it in Afrikaans, it's kokies. It's a little grass ball that you will find everywhere in the stable. It's chewed grass, but it's like in a ball, or sometimes in like a longish thing, okay? From the mouth, yeah, it falls out, because there's a problem with the teeth, okay? So it's something that you will be able to pick up and notify the owner and say, you need to have the horse's teeth checked, because I'm seeing these little grass bundles. I'm sure you're all familiar with this one, okay? The colics, okay? The painful horse, okay? So there's a list this long of things that can cause colic. So you need to be able to recognize, you know, when a horse is in pain. Colic just means, you know, the horse is in pain, is trying to show you that it's in pain. So it's rolling. So let's name a few things that for horses that's painful. So what? Sweating. Ooh, sweating is very bad. No? Sweating is almost close to heaven. Bite, yeah, yeah. Pawing, cup, yeah. Yawning, yawning. Yawning is also indicating that they have some stomach pains. So mostly it's related to stomach ulcers, okay, but yawning as well. Okay, and you guys will also be the first ones to notice the horse's leg that was in the fence, the horse's leg that's broken, or the other photo, he has some blood there on the nose, okay? I like using like a pump, a little canister. It's a pump, okay, but please use the hose pump, it's fine. You can't put too much water on a wound. It's impossible, okay? If you have a horse with a cut and the blood is not squirting to the other side of the stable, just take water and rinse it as good as possible, okay? So throw away the sponges. You know, a sponge, you know what is a sponge? A sponsy. Gooi hulle weg, okay? They only keep all the bacteria there, okay? Ask your owners to buy you maybe like swabs, okay? Because you use it once and you throw it away. If the blood is squirting to the other side of the stable, to put your overall or your towel, if you see the blood is now reaching your hand already, coming all the way through the towel, don't take it off, just keep it there. Take your friend's overall or another towel and just put it on top. You understand? Okay, and you keep it there. And don't look and see, oh, did it stop? Because then it will just start again. Just stand there, okay, while you wait for the people to come. Just stand there from the nose. Okay, yeah, so that one you can't really stop. It's very difficult because it comes from the top, from the sinuses. It usually, so there's two places it can come from. So it comes from there at the top, or it can also come from the lungs. Okay, so normally they don't bleed a massive amount. They do bleed and it looks terrible because your stable walls are covered in blood and everything. But those ones, the vet needs to come and he needs to put a camera up or even do x-rays and see if there's a problem with the sinuses or then the lungs. Eyes are always an emergency, okay? If you see something, you need to tell your owner immediately there's a problem with your horse's eye, because it can go very wrong very quickly. Like, it can only be sore for today. Tomorrow the horse can lose the eye if we didn't treat it today, okay? So it can rupture, it can go blind, and it's extremely painful, okay? So we don't want to leave the horses if they are in pain, okay? Yeah, so what I normally have ice with me, so then I will put, with such swollen eyes, I will put an ice brick on there, but yeah, don't put things in the eye if you haven't notified the owner. So yeah, this is a true emergency, the vet just needs to come, okay? There's not much that you can do at home. Swellings, that's also something that you see a lot. So this is not maybe too odd photos, but remember the legs you see most often that is swollen. This is a stallion, or sorry, a gelding that is swollen underneath its sheath, okay? That is actually cancer, so not much that you can do about it. But you should note that that's wrong for the horse. The horse shouldn't look like that, okay? So it's also a tooth, okay, but it's a swelling. So you see it on the outside, you see the swelling. So you will be able to notify the owner and say, I think there's something wrong, okay, just by looking at the outside. Legs can also swell. So number one thing that I go to when we have a swollen leg is ice, okay? Please forget about the ice boots and the vibration, whatever, and if you use all of your ice, make sure they replace your ice, no? Even if it's the smaller bags of ice or the big bags of ice, even if it's water bottles that you fill and you freeze, okay? If you have a horse with a swollen leg, take your tallest bucket, put your ice water in there, fill it with water, put your horse's leg in there. Sometimes they hate it. Then just try and distract his attention by feeding him while he stands in the water. Okay, so then the skin, okay, it's also part of the horse. So you guys are brushing it every day. So you will notice, the first one that will notice that there's a problem with the hair and the skin, okay? So remember, your hair and your skin can also indicate that the horse is experiencing some sort of disease, some problem. anything that grows out of the skin, or where there's no hair, or you can see the horse is itching, okay? You need to notify your owner that your horse is actually itching. Okay, so that's a sign. So it's something different from just flies irritating the horse, okay? He will just shake his head and swish his tail. So we can get cancers on the skin, we can get allergic conditions, we can get, even when they're allergic to food, it can also show on the skin. So things coming out of the horse's mouth or nose, okay? Is it normal? No, it's not normal, okay? It's a problem. We need to look at, what caused the problem, what's happening there, okay? So you see, you guys know a lot, right? Okay. So don't just see and then you decide, I don't think it's very important, so let me just leave it. I think that the principle is for you just to realize that things that the horse eat, it might affect its performance, and it's not necessarily that you gave it on purpose. It's something that came in the food, okay, that has a similar structure to something that comes in a bottle, a proper medicine, okay? We talked about where the hay comes from. So, the people make sure they buy hay from people that they know they get good quality hay. You don't buy an open bag of food, okay? If you offload the food and you see one is broken, you should tell your owner, listen, this one is damaged. I don't think we should feed it to your horse, okay? Okay, so our horses, they don't, in Windhoek in the stables, they don't necessarily go out to the veld. So they are in their paddocks and they get their grass. But remember, for horses out in the veld, there's that one little plant, I think it's the poppies with the black seeds, the olieboom, okay? It has spikes on it and it has the black seeds in the inside, okay? So those things, they can contaminate the feed of the horses, and that will be picked up as a banned substance, as a medicine when you test them. It's always good, to clean out your horses between stables. So if you go to Swakop for a competition, it's better to clean out your stable before you go in there. So normally the stables are clean, but just make sure, because you can't blame anyone else, no? You just have to make sure that your horse's stable is clean. Also, the feeding troughs, so where they eat. So we sometimes use communal waters, okay? So that might be a problem. Also remember your shoeing area and your wash-off bays, okay? If someone have washed the horse with a shampoo that contains something, and now your horse goes there, it can get contaminated. So it's just things. Okay, so I know that most of you, your medications are stored in your containers, okay? So it should also be cleaned. It should be marked properly. You should also know what to use it for. So let's watch a video on how to apply a bandage to a horse's leg, and then we have a video on the horse inspection. Okay, so it's that we mostly have three things when you put on a bandage. So it's usually something that we can put directly over the wound, that when you take your bandage off, that it doesn't cause damage to the new cells that's there. Okay, so it's normally a smaller little, let's call it a plaster, but something. Then you have a softer bandage, okay, that goes on. Then you have those elastic ones, okay. So it's always good for the plaster to stick on the skin, okay, because then it will hold. But when you stop with the plaster, it's always plaster on plaster. If you stop the plaster on the hair, it will pull off. But if you stop it, so you start there and you stop it onto the plaster, on the tape, it will stick, okay. So you see she's going over the hoof, okay. So I think that's a very nice way. So you don't use all of the sticky, because the sticky ones are very expensive. So they use it at the top and at the bottom to just secure the whole bandage in place, okay. And the hoofs are a nice place for it to grab, it sticks nicely on the hoofs. So you don't want to put it just above the hoof because you will restrict the blood flow. You will cut off the blood flow and the hoof will fall off. Yes. If the wound is bleeding like a lot or it's very dirty, I will change it every day. But when I see the wound is actually now looking good and I don't need to clean it every day, because if you take the bandages off and it's all dirty, you know you need to change daily. If you take it off and you see, yeah, the bandage is still sort of clean, then you can go to 2 days, maybe 3 days. But please don't put a bandage on and chase the horse out to go to the veld and check it in 2 weeks' time. Alright. So sometimes we can leave them for longer, for 3-4 days, but sometimes it just doesn't last that long anyways. So yeah, for the stitching, remember it's also sore for them. So you need medicine to block that wound, and you can't always suture the leg wounds. There's not enough skin to close the wound. So that is your big problem with the skin, the leg wounds. You don't have skin to suture it close. If you close it, it will just be too tight and your suture will tear out and it's just a mess. Okay. I won't put sutures in a horse if I didn't put local anesthetic to that wound and cleaned it properly. Yeah, and sometimes they're very sore, so you need to sedate them. Yeah. Okay. So what do you guys use for ticks and things? Remember always to check, even if your owner gives you a bottle, just check that you see a picture of a horse there, or you can read somewhere. It's fine for horses. Yes.
Fly spray.
Yeah.
It's not effective using it every day.
So there's quite a bit of the fly products that's quite good, but yeah, it only lasts about 8 hours. So you have to put it in the mornings, and then about lunchtime again. So that's the drawback of most of your fly sprays. It doesn't last. We don't have one that lasts a long time. But let's look at the video for the horse inspection, and then we go out. So the vaccinations, the chipped identification, and then we ask for a trot up. So yeah, so they walk for a little part, okay, then they trot, then they turn around, the turn point, and then they come back.
If you have a stallion going to a show, before you go to the show, you say you have a stallion, what stable you want to put him in, on his own, if he's difficult, before you go. And for the vet check, go up to the vet, so the president of the grand jury, and say, my stallion, please may I go last, okay? And they will always allow you, either you normally last, because first with other people, okay? And you can take a stick, he's difficult, nothing is not allowed if he's difficult. And I advise for a stallion to wear a chifney. You know what a chifney is? Okay, well wear a good bit. Don't worry about chifney. It's a round thing with a yoke. But wear a good bit and ask to go last. Don't cause trouble, they can kick and be difficult, okay? Does that make sense? It's very important somebody was talking about a stallion.
So in endurance, we use the ribbons. So for the stallions, they get a yellow ribbon in the tails, okay, so that other people can also see it's a stallion. So we've done a lot of, we've covered a lot of topics this afternoon. So if there are any questions, so even from our presentation or from the horse inspection or from the bandaging or anything else that you just also want to ask, then we can still have a discussion on that. So I think everyone, you have, your trot out is quite good, your presentation is good. So just always remember to have a loose rein, okay? You don't want, because what happened if it's tight? Because every time you run and you move your arm, you pull the horse's head, okay? And then we can actually not see, is the horse lame or is he sound? Because you are now pulling the head, okay? So it's much better for your horse if you make sure that you have a loose rein. Okay, but some horses you need to train them a little bit at home before you arrive at the event to be able, and that's what she's talking about, don't drag the horse. So learn it so that he trots next to you, okay, with that command. So that we say trot.